the MAHA Commission releases their assessment on childhood chronic disease. A popular prior authorization reform bill is reintroduced. And the House takes a major step in the budget reconciliation process. For the week of May 27th, 2025, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
I've been very consistent with our colleagues in the Senate. We've worked hand in glove with them all through this process, remembering that the House began this more than a year ago. It was March of last year when we got our committee chairs together and told them to begin to prepare for this massive reconciliation package. We believed at that time.
The House of Representatives passed the GOP's budget reconciliation package last week, achieving Speaker Mike Johnson's goal of completing work on the bill before the chamber's Memorial Day recess. The legislation narrowly passed the House in a 215 to 214 vote early Thursday morning after an all-night debate. Representatives Thomas Massie, a Republican from Kentucky, and Warren Davidson, a Republican from Ohio, joined Democrats in voting against the package. Representative Andy Harris, a Republican physician from Maryland, voted present. Representatives Andrew Garbarino, a Republican from New York, and David Schweikert, a Republican from Arizona, did not vote. The One Big Beautiful Bill Act stems from the fiscal year 2025 budget resolution approved by Congress in early April and is central to Republicans' broader effort to implement key parts of President Donald Trump's domestic policy agenda, including tax reform, energy development, and stronger border enforcement. Prior to passage of the more than 1,000-page bill, several fiscal hardliners secured an agreement with GOP leadership to make a number of modifications to the legislation. The bill was revised to speed up the start date of work requirements for Medicaid beneficiaries from January 1st of 2029 to no later than December 31st of 2026. The revised bill also broadens the ban on Medicaid funding for gender-affirming care from minors to all individuals. The package includes a series of changes to the Medicaid program beyond these provisions, including new limits on provider taxes, penalties for states who allow Medicaid coverage of undocumented immigrants, cost-sharing requirements for Medicaid enrollees, and more frequent enrollee eligibility checks. The legislation does not address the 2.83% Medicare physician cut that went into effect on January 1st, but it does include a mechanism to link the Medicare physician fee schedule conversion factor to an annual inflationary update. In 2026, physicians would receive an update of 75% of the Medicare Economic Index, or MEI. In 2027 and each subsequent year, physicians would receive 10% of MEI. It would also eliminate the current merit-based incentive payment system and alternative payment model differential payment updates. According to a Congressional Budget Office estimate of an earlier iteration of the bill released on Tuesday, prior to House passage of the bill, the legislation would lead to 8.6 million people losing their health insurance. Approximately 7.6 million people would lose their Medicaid benefits, while approximately 1 million people would lose access to plans purchased through the Affordable Care Act marketplace. CBO's estimates of coverage losses are expected to be higher under the version of the bill passed by the House last week. The package remains subject to consideration by the Senate, where it's expected to undergo significant changes. Several Republican senators have already expressed concerns with the Medicaid-related provisions of the House package, making it likely that the health portions of the bill will be revised before final passage. Republicans aim to have the One Big Beautiful Bill Act signed into law no later than July 4th. This goal is informed by debt ceiling considerations. The reconciliation package includes an increase to the statutory debt limit, with the nation projected to reach its borrowing limit as early as August. If the Senate amends the reconciliation legislation, the House will need to vote on the amended legislation, or the package would need to be reconciled via the conference committee process.
Prior authorization is the number one administrative concern to physicians. It adds to their burden of their day, having a patient scheduled for a hip replacement, having them in the preoperative area, and then finding out that the insurance company has not done the final prior authorization.
That was the voice of Senator Roger Marshall, a physician from Kansas, and one of the sponsors of the Improving Seniors Timely Access to Care Act, which was reintroduced in Congress last week. The bipartisan bicameral legislation aims to simplify the prior authorization process within the Medicare Advantage program. It would establish an electronic prior authorization process for Medicare Advantage patients, increase transparency around Medicare Advantage prior authorization requirements, provide a pathway for the Centers for Medicare and Medicaid Services to institute real-time decisions for routinely approved items and services, and clarify CMS's authority to establish timeframes for e-prior authorization requests, expand beneficiary protections to improve enrollee experiences and outcomes, and require the U.S. Department of Health and Human Services to report to Congress on program integrity efforts and ways to further improve the e-prior authorization process. Alongside Senator Marshall, the bill is sponsored by Senator Mark Warner, a Democrat from Virginia, and in the House by Representatives Mike Kelly, a Republican from Pennsylvania, and Susan DelBene, a Democrat from Washington, as well as Ami Bera, a physician and Democrat from California, and John Joyce, a Republican physician from Pennsylvania. It currently has 47 co-sponsors in the Senate, 77 co-sponsors in the House, and is supported by more than 150 stakeholder organizations.
Last thing I will mention, of course, I'm deeply involved in appropriations. That's been overshadowed, appropriately so, by all this, but we did release a schedule that we will mark up the funding bills for in July and June and July. Our aim is to get that across the lines. We did announce.
That was House Appropriations Committee Chairman Tom Cole, a Republican from Oklahoma, who last week released his panel's markup schedule for fiscal year 2026 appropriations bills. The committee currently plans to mark up all 12 fiscal year 2026 government funding bills over the next 10 weeks. Chairman Cole told appropriators that they should expect to see bill-by-bill funding allocations shortly after coming back from this week's Memorial Day recess. While the schedule is subject to change, Agriculture, Rural Development, Food and Drug Administration, and related agencies bill is scheduled for subcommittee markup on June 5th and consideration by the full committee on June 11th. The Labor, Health and Human Services, Education, and related agencies bill is currently slated to be marked up in subcommittee on July 21st and considered by the full committee on July 24th.
4 months ago, I created the Presidential Commission to Make America Healthy Again, and today the Commission officially delivers its first report on childhood health. Here are just some of the alarming findings, and they really
Final news
are
today,
alarming.
where the Presidential Commission to Make America Healthy Again, or the MAHA Commission, released an assessment last week of the drivers behind the rise in childhood chronic disease. The commission was established by an executive order signed by President Donald Trump in February and is led by U.S. Department of Health and Human Services Secretary Robert F. Kennedy, Jr. The 69-page report identifies 4 potential causes of childhood chronic disease that the Commission believes present the clearest opportunities for progress. Those include poor diet, aggregation of environmental chemicals, lack of physical activity and chronic stress, and over-medicalization. The report also recommends 10 research initiatives to close current knowledge gaps and guide future work on childhood chronic disease. Secretary Kennedy has stated that the report will serve as a blueprint for the administration's health efforts. The MAHA Commission's strategy report, containing policy recommendations, is due in August of 2025. We end each week's episode with the call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. The first and only healthcare event currently on the calendar will occur on Wednesday, June 4th at 10 a.m. when the Senate Health, Education, Labor, and Pensions, or HELP Committee holds a hearing titled Reauthorization of the Over-the-Counter Monograph Drug User Fee Program. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.